Imagine this. You've just finished a particularly grueling session at the gym, the kind where you feel like you've sweated out every bad decision you made last weekend. You wipe your brow with a crisp white towel. You glance at it. There's a faint, unmistakable smear of blue. Not dirt, not ink. A cerulean stain coming straight from your pores. Or maybe you're crying at a sappy movie and your tears have a hint of aqua. Sounds like sci-fi or a biological glitch. But this is real. It's called chromhidrosis. So how does a person start leaking color? Our bodies are usually predictable factories of neutral fluids. Sweat is clear. Tears are clear. We don't expect bodily fluids to look like watercolor. A bright hue shows up. Of course you're alarmed. Is it an exotic illness or accidental radiation, Spider-Man style? Usually the truth is less dramatic and more interesting. Blue sweat often starts with something you consumed, a pill or dye traveling through your body plumbing and making a colorful exit. It's a story of chemistry, biology, and the odd ways our systems process what we eat and drink. Often the culprit is mundane, a medication, a dye, a particular chemical. The body is a processing plant. Take what it needs, discard the rest. Urine is the famous route, but not the only one. Our sweat glands and tear ducts are minor secondary exit pathways. If the substance is brightly colored, it can color those excretions. The blue on your towel isn't doom. It's a postcard from your body's filtration system saying, "I'm working." Let's peel back the layers. When you swallow a pill, you're kicking off an elaborate internal journey. Think of it as mailing a package to a specific organ or system in your body. The pill first tumbles into the stomach, a churning acid bath designed to break things down. Here, its protective coating dissolves, releasing the active ingredients. These molecules don't just magically appear where they're needed. They have to catch a ride on the body's superhighway, the bloodstream. From the stomach, from the small intestine, the drug molecules are absorbed through the intestinal walls and into the vast network of capillaries, tiny blood vessels that act as on-ramps to the main circulatory freeway. This is the moment the drug truly enters your system, ready to begin its grand tour. Once in the bloodstream, the drug is whisked away on a high-speed adventure, traveling to every corner of your body in a matter of minutes. The blood acts as a universal delivery service, carrying oxygen, carrying nutrients, and now your medication to the brain, to the heart, to the muscles, to the skin. It's a remarkably efficient system. The drug molecules circulate, bumping into various cells and tissues until they find the specific receptors they are designed to interact with. This is where the magic of medicine happens, where a painkiller blocks a pain signal or an antibiotic begins its assault on invasive bacteria. The drug is now officially on the job, performing the task for which it was prescribed. But the body is also a diligent housekeeper. It doesn't like foreign substances sticking around indefinitely. The primary cleanup crew consists of the liver and kidneys. The liver, a master chemical plant, works to metabolize the drug, breaking it down into different, often less active compounds called metabolites. These byproducts are then sent back into the bloodstream. From there, the kidneys take over, filtering the blood with incredible precision. They pull out these metabolites, along with other waste products, and mix them with water to create urine. This is the main exit strategy for most drugs, the primary route by which your body says, "Thanks for your help, now it's time to go." However, this isn't the only way out. The body has several other, less prominent, exit doors. Our sweat glands and lacrimal, tear glands, are also connected to this same circulatory system. As blood flows through the tiny vessels surrounding these glands, small amounts of water, salts, and, yes, drug molecules can pass through their walls. The glands then secrete these substances onto the surface of your skin or eyes. While the volume is much smaller than what the kidneys handle, it's still a viable, if minor, pathway for waste disposal. This is the crucial step where a substance circulating in your blood can make the leap into your sweat or tears, setting the stage for a colorful surprise. So, Why are some drugs and chemicals colorful in the first place? The answer lies in their very structure, at the molecular level. Color is all about light. White light is actually a rainbow of colors. Each color has a specific wavelength. When that light hits an object, molecules absorb some wavelengths and reflect others. The color we see is the reflected light. Example: a red apple absorbs blue, absorbs green, absorbs yellow, but reflects red. A substance looks blue because it absorbs red, absorbs yellow, and reflects blue. Molecules that absorb visible wavelengths are called chromophores. The arrangement of chromophores in a molecule determines color. Many dyes in clothing, in food, and in medicine use complex chromophore systems. Classic medical example: methylene blue. Its atomic arrangement and double bonds let it eat orange-red light, so it reflects deep blue. When you ingest it, you're swallowing millions of light-reflecting molecules. Color can be functional, sometimes added for identification, like a 50 milligram pill versus a 100 milligram pill, or to make a liquid medicine more appealing to children. Other times the color is part of the drug's action. Methylene blue is used as a medical tracer, used to treat methemoglobinemia, and used as an antiseptic. Its color is inseparable from its chemical identity. Those same properties make it leave a colorful trail through the body. Some substances enter colorless, but become colored after chemical transformation. Often that's oxidation, reaction with air. A chemical in your sweat can be colorless at the pore, but after mixing with oxygen on skin, its molecular structure changes. A new chromophore can form and, voila, color appears minutes later. The color isn't coming out of you. It's being born on your skin. When it comes to drugs that can turn your sweat or tears blue, one name stands head and shoulders above the rest: methylene blue. This is the poster child for colorful bodily fluids. As a potent blue dye, it's used in diagnostic procedures to stain certain tissues, making them more visible during surgery, and as an antidote for specific types of poisoning. Patients who receive methylene blue are almost always warned to expect a dramatic change in their urine color, which can turn a startling shade of blue or green. Less commonly, but just as dramatically, this vibrant hue can make its way into sweat and tears, leading to blue-stained clothing and alarming-looking teardrops. The effect is harmless and temporary, fading as the drug is fully flushed from the system. While blue is the most shocking, other drugs can impart their own signature colors. The antibiotic rifampin, used to treat tuberculosis, is famous for turning bodily fluids a reddish-orange color. Patients on rifampin often report orange urine, sweat, tears, and even saliva. This side effect is so common that it can permanently stain soft contact lenses, a quirky but important detail for doctors to mention. Similarly, some laxatives containing phenolphthalein can turn urine pink or red, and traces of this could theoretically appear in sweat. The chemotherapy drug doxorubicin is known as the Red Devil, not only for its harsh side effects, but also for its vibrant red color, which predictably colors the urine of patients who receive it. Beyond prescribed medications, other culprits can cause this colorful phenomenon. Certain bacterial infections are known for producing pigments. Pseudomonas aeruginosa produces a characteristic blue-green pigment called pyocyanin. In these cases, the blue-green color might appear in pus or fluid oozing from an infected area, which could be mistaken for colored sweat if the infection is near sweat glands. This is a more serious cause, as the color is a sign of an active infection that requires medical treatment, not just a harmless dye passing through. Let's not forget the rare but fascinating genetic conditions. One historical curiosity is blue diaper syndrome, a rare metabolic disorder where an infant's body can't properly break down an amino acid called tryptophan. This leads to the formation of a chemical called indigo blue in the gut, which is then excreted in the urine, turning the wet diaper blue upon exposure to air. Though not related to drugs or sweat, it illustrates the principle that the body's own chemistry can sometimes be the artist. This array of examples shows that while a drug is the most likely suspect, the world of colorful excretions is surprisingly diverse, spanning from medicine to microbiology. So when should you worry? And when should you just admire the hue? For the most part, a sudden shift to blue sweat or tears, while visually dramatic, is usually benign and temporary, often linked to something you've ingested. If you've recently started a new medication or had a procedure with a dye like methylene blue, the color is almost certainly an expected side effect. It's cause and effect. The color is transient, just passing through on its way out. Stay hydrated, help your body flush it out. Wear older clothing for a day or two, avoid staining favorites. The novelty will fade as your body cleans up. But don't dismiss every color change. Context matters. If the color appears out of the blue and you can't link it to any new drug, food, supplement, talk to your doctor. If colored fluid comes with other symptoms, if you notice blue-green sweat with pain, redness, swelling, a foul odor in one area, it could be Pseudomonas, which needs antibiotics. If it comes with fever, discomfort, or feeling unwell, seek medical advice. Imagine a patient after minor surgery who sees a blue-green stain on their bandage. They might think it's ink or surgical marker, but if it's from the wound, worry sets in. They call the doctor and are told to come in. A swab confirms Pseudomonas, treated effectively with the right meds. Paying attention and getting help early prevented worse problems. Use color as information, not just curiosity. In short, reassurance with caution. Your body is a chemical factory. Its byproducts can be colorful. Often, blue sweat is a ghost of a medicine past, harmless and temporary. Still, be observant. If unexplained color appears, or it's with worrying signs, check with a healthcare professional. They'll help tell harmless quirk from a real problem.